I'm speaking with Jacqueline Lim, who has just published an article in Rural and Remote Health titled Look at Mummy, Challenges in Training Parents to Deliver a Home Treatment Program for Childhood Apraxia of Speech in a Rural Canadian Community. Welcome, Jacqueline.
Hello.
Hello. So I wonder if I could ask you a few questions about your article, starting
Sure.
with what is childhood apraxia of speech?
So childhood apraxia of speech, or CAS for short, is actually a motor planning speech disorder. So what that means is that the child has difficulty putting together the speech sounds for speech.
So how did this research come about?
So this research is actually part of my PhD that I am doing through the University of Sydney. And it actually came about because at the time I was working as a clinician in a northern remote community in Canada, and I was having a lot of trouble providing services to children with complex conditions like CAS. And so I wanted to explore what the feasibility was of training parents to deliver the services instead.
Right. Why were there difficulties in particular for rural children?
Well, for one thing, it's a large geographic area, and I was the only speech pathologist in the health region then. So I had a large caseload and also quite a complex caseload because in rural communities, especially in northern Canada, you have a lot of the social determinants of health really impact the community, for instance. So I had a lot of kids on the caseload and a lot of kids with complex conditions such as CAS because of things like poor nutrition, poor health indicators, for instance, and all those sorts of factors that you find in similar communities.
So before we get into the findings, I wonder if you could introduce the research team.
Sure. So it's myself and my two PhD supervisors, Patricia McCabe and Alison Purcell, who are both from the University of Sydney.
Terrific. And what did you find?
Well, we basically found that parents had a lot of trouble implementing the treatment protocol at home. They had some trouble with following the process of the program, but actually more than that, they had a lot of trouble actually doing the therapy with the child. Their child would not comply, would not sit down, would not pay attention. They had a lot of behavioral issues that they had to deal with. They had a lot of external issues, like, for instance, in these communities that I was working in, there's a lack of childcare. And so some of the parents had to look after family members' children as well. So they had a house full of children and they're trying to do this therapy with their child. It was very, very difficult for them. And also because it's a rural community, they're often traveling out of the community for medical appointments or to see family. So there's a lot of disruption in their daily routine because of that. So those was just some of the challenges that the parents faced.
So what's next? What kind of research will follow up from this?
Well, basically, we have to look at whether these issues also can be found in other communities, for instance, and perhaps more urban communities. And the communities that I was working in was quite socially disadvantaged. So does it make a difference if you have a different socioeconomic class, for instance? The other thing that I actually find quite interesting right now in this particular time is that with COVID-19, for instance, a lot of speech therapists are actually moving to either moving away from face-to-face service delivery and either doing it through telehealth or setting up home programs for parents. So I think it would be quite interesting to see in this environment when parents have even added stress, whether that is going to make it even more difficult, or conversely, especially if the COVID-19 restrictions go on for quite a while, do parents actually become better at managing their child's behavior, at being able to follow instructions with their child, and do the children actually become better and more adept at sitting down and listening? So it would actually be quite interesting to see that through a longer period of time if this actually can work.
For sure. So is that research that you're undertaking at the moment?
Well, COVID-19 is still pretty new, so it might be something that we might have to start thinking about pretty soon.
Yeah. Has it changed your own clinical practice, COVID-19?
COVID-19, yes. Well, for instance, I'm currently no longer in Northern Canada. I'm working in Townsville at James Cook University. So it has affected how we deliver services through our student clinic. We're at that stage now where we have to think about how we're going to deliver the services and what format it's going to be and how that's going to impact not only the clients and parents, but also the student clinicians as well.
Interesting times.
Yeah, that's right.
Thank you very much for speaking with me. I look forward to hearing about your new research when it comes out.
Sure. Thanks very much.
Thank you.
See you later.